A few days before I had my stroke, I was preparing to go to the presidential inauguration in Washington. I had a little stressful things going on at home. I was actually in the process of going through a divorce, so that was a stress factor. So I needed to get away. So mentally, no, everything wasn't fine, but it was a relief to get away and go to the inauguration.
The morning after returning home, Tokashemia Carter had difficulty speaking and lost sensation in her body. This young mother of 4 girls soon learned that she had experienced a small stroke in a deep part of her brain.
With most patients, stroke is caused by cholesterol, blood pressure buildup that clogs arteries. She didn't have any of that, so we looked for unusual causes. And one unusual cause is a hole in the heart. We did some blood flow testing in her heart that showed, in fact, that instead of flowing to her lungs, there was some blood flowing directly across the heart, from the right side to the left, and that was a way that a clot could get to her brain and cause a stroke.
Patent foraminopathy, or PFO, is a common cause of ischemic stroke in young people like Tokashemia. As a nurse, she knew the importance of timely medical attention for stroke. She also knew the value of clinical studies, which is why she joined a study for PFO closure devices. Tokashemia was randomized to receive the device implant.
I didn't feel any different. I was able to do what I normally did before I had the stroke: exercise, run.
We've seen that patients who receive that device have less than 1% risk of stroke going forward. That's wonderful. That's really a sign that she's got 4 young children, a life ahead of herself, a career ahead of herself in nursing to help other people with medical problems. And if we can intervene in that kind of a young woman's life and give her many more years without disability, that's what all these studies are about.
A decade ago, strokes were the 3rd leading cause of death in the United States. Today, they are the 5th leading cause. The clot-busting drug TPA is still the only FDA-approved drug for ischemic stroke, but TPA only works about 40% of the time and must be given within 3 hours of the onset of symptoms. Volpe says for the other 60% of patients, physicians need more treatment options, and advancing clinical research is the best way to give patients more choices.
There are tiny strokes like Tokashemia had. And she's fortunate because we've seen patients who have similar tiny strokes have permanent memory loss. Less than 1 centimeter of brain is lost, and they permanently are different afterwards. That's an area that on one hand is fascinating, but it's also very challenging.
I'm back to living my life, working, continuing my education, spending time with my girls, just basically enjoying being me.